Guys, once we are on the Facebook page, live on the Facebook page, please, guys, let me know. What I need to do is here, I need to do something. So this one, and then this one here. Actually, no. Let's get a new, yes. Okay. Please, guys, if I am alive on the Facebook, please let me know. By the way, let me share the screen first. Zoom, yeah. Share. Please, admin, if possible, can you share the link for the Facebook Live to all the champions here right now? Please, guys, click on this link. And then if you have any question or you have any comments or any suggestion, you can definitely, you are very welcome. To ask there on the Facebook. Okay. Now, if you are part one candidate, I'm telling you today, you're going to know lots of good things about denture stomatitis and angular cheilitis. If you are part two candidate, I know this is the first time, I believe since long time, we back again to do no-fees program sessions for either technical or for communication skilled OSCE. Sorry, the communication OSCE. Saying this, that will be a good start for us to help you through our private sessions. And then for the public, the way we used to do. By the way, if you guys new into ADC, we are the first people ever. Definitely, guys, you can check this on our Facebook page or our Facebook groups. We are the first people ever who started to do no-fees program sessions for role plays. And we are very happy to redo back again, because at this stage of the time, we're waiting for part one result. And then we focus more right now in part two, both together equally, part one, part two. And it's a good time to let part one candidate to know what is skilled OSCE. And it's best time as well to support our candidate, not just only through our private sessions, also for the public, and also we are very happy to help the people they cannot afford for the course, because I knew some people they paid for courses and they couldn't pass because they take these courses and they want to take our courses, but the problem is they don't have enough money. So somehow we try to help them throughout this sessions. Today, it will be a surprise because I have two options, by the way. Is to do role play with any one of you who's interested really to do it. One of the champions, they have exams soon. I'm very happy to do this. Or we can do it with Dr. N. Everyone guys knows who's Dr. N, am I right? Let me check the Facebook right now. Give me 1 second, please, guys. For me, skilled OSCE, or communication OSCE, since 2018, I found people that struggle with communication OSCE. Lately, we found our candidates in the beginning of this year because we have changed our system somehow. We found our candidates, they're always the highest. They're always the leaders. And that's why I'm very happy today to come and give you some of this experience. What does make our champions completely different this year? Let me check here. Yes, I can see, seems like yes, that is great. I see there is about 50. Okay, very good on Facebook. I'm very happy, guys. I'm very happy to see you all here today. Please, guys, we see above 100, like 116 people on Zoom. That's okay to be on Zoom. But if you want to communicate with us, you can join Facebook. And then the link you'll find it in the chat. Hi, Dr. Fatima, how are you going? Hi, Dr. Sangita, how are you going? How's every one of you guys? Okay. Dr. N, can you hear me?
Yes, Dr. Adam, I can hear you. How are you?
Good, thanks, Dr. N. Hi, Dr. Tanvir, how are you going? Dr. N, what do you think about OSCE overall? Is it really something hard to pass, generally?
Um, no, honestly, no, I don't know. I don't think so. I really don't.
Yes, if you won't really help the champions here today, and then they are really worried and concerned about OSCE. Do
Mhm.
you think why they always been worried about OSCE, or what are the main things they cannot, they don't do it to pass OSCE?
Um, okay, I'm gonna tell you something about me. I've given this exam more than once, so I'll tell you something that I've always passed in my OSCEs. The reason is that I always listen, even if the patient is blabbering, even if the patient is eating up my time, I do not let any sort of panic show on my face. Okay, and I let the patient finish. Okay, whatever it is, whatever the concerns are, whatever it is, and once they're done, I reply to them. I do not ask them silly questions that, like, what is your name? Like, if they just mention their name, I will not ask it again just because I have to, check box or put a tick against my criteria. I will just listen and reply like a human being. That's it. There's no rote learning in OSCEs. It's just a conversation between two human beings like you and I are talking right now. So I haven't prepared anything for you and me. I just know that you've asked me a question and I'm answering that question. That's it. And this is exactly what OSCEs should be about.
I agree in this. So what do you think about the candidates? They think OSCE should be a setup of or a set of a role play. They must memorize it before they go to the exam, and then they have to say it. Otherwise, if they don't say this set of information, they will fail. And then they start to shower the patient with lots of information, unnecessary, irrelevant information. What do you think about this?
Honestly, doctor, I think everyone should know that they are already dentists and they do not need to, you know, unnecessarily bother the patient with a lot of information. Just imagine your mother being in that chair and imagine using big terms or unnecessary information, showering her with these many things. Imagine what she would react to it. Like, how would she react to it? It's really not about showering with information. Okay. So, somebody's asking here, what is OSCE? So I'm going to tell you, OSCE means objective, structured clinical examination. It's part of part 2. And Dr. Adam, you asked me that you need to be prepared for OSCEs. 100% yes, you need to be prepared. You need to have clinical knowledge in order to tell someone. You can't give out wrong information. Just be very natural. Do not let your body, the minute you enter the room, the the communication OSCE room, you should behave like a dentist because you are one. Okay, this is your clinic. This is the room that you consult with. That's all should be in the mindset. And yes, you should be prepared with the information. That's it. And the 3 minutes time that they give you should be to orient yourself in that proper case. Like, I see a case in front of me. If I get a 3 minutes time, I will get, oriented to the case. Okay, this person's name is Andrew, and this is the concerns that the patient is here for. And this is how I will be asking the questions in order to know a little bit more about this patient. And I will be happy to help them accordingly. This is how it should be.
I agree in this. Look, guys, I'm telling you a secret to pass OSCE. That's a secret. If you want to take it, take it. If you don't want to take it, it's up to you. I'm very direct in this point. Do you know how much I like you and how much I really love to see you being successful? OSCE mainly about, it has a lot of things. It's like a big package. It's not only just one thing, but I will tell you, most of the candidates they're concerned about to finish the task, to mention every single word in the task. I'm telling you, that's the least important thing in OSCE. To pass OSCE, as Dr. M mentioned, you must be a good listener. Listen and find solution. Write down these 2 words, guys. Listen and find solutions. Don't be against the patient at all. Don't make the patient feel low. Never make the patient feel low. Even if they don't brush the teeth, even if they don't eat healthy, even if they don't see their GP, never be against them, never make them feel low. This is one of the secrets about OSCE. 2, you must give priority to the patient's concern, not what you studied. It's not about TG, it's about what the patient's concern. Make it easy for the patient, make the patient happy. Bold parrot. That's a guy's called the bold part. Look at this. Candidate task. So today, Dr. N, her bold part is to address the patient's concern, explain the condition and the management to the patient, outline the immediate and long-term management plan. These things need to be covered. You know what? This all can be covered only in 5 minutes, believe me. 5 minutes can be enough to fix the 3 points and you finish the whole case. Guys, if you still, because I see now you are on the Facebook, and then if you still guys have any question, you can ask generally any question in your head. We'll be happy, guys, to take these questions from you. Now, Dr. N, back again.
Yes, doctor.
Let's say now you have a 3 minutes, because guys, in OSCE, you will get 3 minutes reading. And then you can write down whatever you want. In the 3 minutes, what is the best way to use your own 3 minutes in the beginning?
Honestly, this is the time that you use to get familiarized with the patient's concerns. And like Dr. Adam mentioned, the bold part is extremely important. So you make sure that you highlight the bold part because the minute you enter this room, there will be a screen and then you'll be sitting. So in that portion, you need to understand the bold part, whatever it is. Like here I see the patient concerns needs to be addressed. So here I will firstly ask the patient, please elaborate about your concerns, because there is a possibility that he might have some hidden concerns apart from whatever is given on the screen. Okay. So I need to ask about the concerns. This is my first task. My second task would be to explain the patient that whatever condition they have, like we see the pictures, I've done my initial examination. I do know as a dentist, you all know as a dentist, what is the condition, okay? And how am I going to manage this person, okay? This is my second task. Third would be to form a structure so that my patient feels comfortable with immediate management, because I need to provide my patient with immediate help, because he's here, he's concerned, he's stressed. Imagine that you have some concerns and you need them addressed immediately. Okay. So we need to address that, and we need to talk about long term as well. That this is something that I'm doing today for you, but this is something that I will do in the future for you, because you and I are a team. These are the three tasks that I need to complete within my 10 minutes time. So my 3 minutes are going to be dedicated only for this. In order to achieve these three tasks, I will formulate my plan on a piece of paper. Okay. So usually what I do is, if there are some diagrams that can help me understand, like help me make my patient understand what I'm trying to explain, I would draw them, or I would just write down, because I see here what the case is about. Okay. So I will just write down the risk factors of the case. Okay. Because I do know what the diagnosis is in my head, I will just write down the risk factors. So that whenever I'm talking to the patient, I can tick them off that yes, I've asked this thing, I've asked this thing. Oh, this is the reason why this patient has this problem. So we need to understand what exactly were the risk factors. They're very important. So once I'm done with my risk factors, I will move on to explanation of my diagnosis and management, because this is why the patient is here to see me today. They want to know what is happening to them. Okay. So I will make sure that I'm very crystal clear, and I'm not using some heavy words or any heavy information that is too much for them. Okay. I will just explain them that, like we talked right now, and this is a key thing that I found out. So this is what is happening with you in a very simplified manner. Nothing too large, nothing too heavy, because my patient is not a doctor. My patient is not a dentist. I need to level down to them and make sure that they understand and they're following me. That's it. Okay. So for that, I will ensure if I need some diagrammatic help, or I need to go onto the screen and, like point out to the pictures or anything like that, I will do that. So this is basically in 3 minutes that I will, get myself ready for the case, for the patient.
I love, Ray, to hear this, especially when you mentioned about the photo. It's very important to explain the things on the photo, right?
Yes, absolutely.
Very,
Because
very, it's
this is
really very,
something,
yes.
these are the aids provided, and we should use them to our benefit. Because if we've taken some pictures and, like the patient might be wondering, why did she take my pictures and what was it all about? So when I have a picture in front of me, that is my aid. I can point it out and see, this is your mouth and this is the thing that is happening here, and we need to help you cure it. That's it. So they will also be on board with me that, oh, now I see what you mean.
That's good. That is great, Dr. Rand. And I really love what you mentioned right now. Okay, guys, I hope, guys, every one of you got pen and paper and then write down all these notes, because believe me, that is the way you need to pass the exam. And also, please listen to our role plays, me and Dr. N together. See how we're going to take it nicely, easy, simply. There is no any complication in it. You don't need to discuss any complicated terms or any complicated conditions. You don't need to discuss that much about dentistry, but you need to look after the patient. That's a word, look after the patient. Okay. I see some questions here, right? And you know what, guys? We'll take your question later on after the session, okay? After the session, we're going to take your questions. By the way, guys, feel free to ask as much as you want. Okay, Dr. N, are you ready right now?
Yes, doctor, absolutely.
Are you feeling stressed at all? Maybe?
Yes, because you're the patient.
No, like I will be very good patient, okay? Okay,
Thank
that's
you for
fine
that.
then. Okay, no problem. Thank you very much. Okay, guys, so as you see right now, it's a communication, OSCE. And then we're going to talk about denture stomatitis and angular colitis case. And by the way, this is just a start because we plan right from now on, we will have this, our no-fee support role play session from time to time. The scenario is like this. You are a dentist, which is Dr. N, in a general practice. An 82-year-old patient, his name is Andrew, wearing complete dentures. Presents complain of soreness under the upper denture and the painful crack at the corners of their mouth, like this one. In the scenario, I haven't mentioned anything about the diagnosis. Guys, do you think I already mentioned anything about diagnosis here right now? Did I mention in the scenario itself, did I mention there is angular colitis or denture stomatitis? So it means this case is actually diagnosis and management case. What does it mean? It means you need to provide the diagnosis, as you see right now, explain the condition, which is diagnosis, and then manage the condition. Imagine, if you don't mention the name of these two conditions, you will not be able to pass the exam. Yes, it is. If you don't mention the word denture stomatitis, which is inflammation has happened because of the denture or any other reasons, and then especially in the bearing area, and then if you don't mention the angular colitis, which is about crack or inflammation on the cracks on the corner of the mouth, I would say in this case, you're going to lose marks and the patient will not be able to understand what you say. So now, the scenario itself, it hasn't mentioned anything about the diagnosis, but they provide you with two photographs. It is your job as a dentist to interpret these two photographs nicely, easily, simply, with very easy language. You don't need to complicate the things. You don't need to use wow language. As long as the patient can understand you, that's enough. Patient understand you and you understand the patient. That's enough. No more than this. Right? I don't recommend that all. I know Dr. N exactly knows what she's going to do. I don't recommend at all to ask many questions, multiple questions. Not needed, not necessary. The more you ask questions, the more you make the patient upset and angry, as if I'm not in police station. I'm not in a court. Help me. I need your help. Am I right about this, Dr. N?
Yes, doctor, absolutely. Also, I see a question here, and Dr. Ambish is asking, when I'm doing a role play, I don't have difficulty, where is it? Answering the patient's question, but when I try to be structured, I feel robotic and artificial. But when I do it like a conversation, it feels more natural and unstructured. Which one would be a better approach? So, do you mind, Dr. Adam, if I answer this question really quickly?
Definitely. I will be happy to
Okay.
answer it.
Okay. So, Dr. Ambish, so whenever you're answering the questions, that's because you're answering out of your mind. Okay. This is why it's very natural. Okay. But if you are, let's say you feel robotic, why? Because you're following a certain set of pattern, which is not required. Honestly, it's not required. You wouldn't like it if I will, like have a paper in front of me and I'll be, like following a certain pattern to answer your questions. You'd only want it the way you just want me to answer your question. That's it. So to be structured, you just need to make a flow chart on your piece of paper. That's it. In case you're having a conversation and you feel that you're missing out on any points, You can always say to the patient, because it's normal to say that, that, give me a second, I just need to orient myself. That's it. And look down on a piece of paper and see what you've missed and what is, what is there to cover up. That's it. Be in a conversation. The patient will mind. That's it.
Okay, look at this, guys. If I were in your shoes and I have 3 minutes to answer this case or to go throughout this case, the first things I will do is, guys, what do you think the first things I will do? Yes, I see the answer right now. You're right, doctor. It is to read the board part. This is the part we need to read. By the way, guys, I have seen lots of people pass the exam and lots of people fail the exam, right? Both. I have seen both of them. I'm telling you the way that the people pass the exam, okay? First, you look here at the bold part. What is the first point in bold part? Address the patient concern. In my head, I will say this to myself: listen, answer, or actually, I'll make it this way: listen, good body language, reassure. Actually, before reassure, body language, show understanding, then reassure, then answer, which is find solution. This is the address the patient concern. Any concern, it should go in into these steps. If you're gonna miss any of these steps, I'm telling you, good luck. Right, Dr. N?
Yes, Doctor, I agree.
Okay, let's guys do a small look. You are here to learn, right? And we're gonna do the role play shortly right now. But I don't know, every time once I start to do the role play, I feel I really need to give you more information. The information never ends from my side and Dr. Ann's side. Now, let's do this as an example right now. If we take this example with this case or any other case, okay? If the patient's telling you this case, let's say the patient concern something like, doctor, I'm here today because I don't feel well. I don't feel well. The top of my mouth is really sore. And every time I bite on my top denture, it does rock and then fall down. Do you know? That's exactly what I'm going to say right now. While the patient say this, I would say, I hear you. I listen to you. Right? That's called listening. By the way, that's the way you make the patient feel happy because they know you're attentive. Body language. You know what will I do by my head? I nod like this by my head, as if I listen. Like my head, I keep shaking it. Forward and backward, as if, yes, I listen, I hear you. Then show understanding. Once the patient finish, I say, I understand your concern right now. And then reassure. Or even sometimes when I show them understand, I may repeat the same thing. Now, Andrew, I understand that you are here today because the top of your mouth, which is a roof, it does hurt. And also the top denture is rocking. Now I will reassure the patient. That's something easy to be fixed. I know how can be big for you, but it's something easy to be fixed. No concern at all at this stage. I will treat the sore mouth And also, I will make your denture stable. Now, I reassure the patient, I answered the patient's concern, and then I found solution, which is I'm going to discuss a little bit more about the case, and then I will go to different points. Let's do this in one way right now. I will tell Andrew, I listen to you, Andrew. And then I nod my head. I understand you are here today because the roof of your mouth is actually sore and the denture is broken and it does fall every time you eat and drink. That's something easy, will be fixed. I will make you happy today going out from the clinic. How does it sound to you, Andrew? Here it's called communication skills. Guys, do you think I sound robotic by this way? It's just only one sentence. Do you think I sound robotic? Or just I say good things in the beginning? You can say it differently the way you want. Now, Dr. Ann, what do you think about this?
That's nice, doctor. Like you mentioned that you listen and then you say that I hear you. Even if you don't use these words, use your body language. That is actually very true. You can nod your head and you can pretend to write down if there's an important stuff. Don't pretend, just actually write down because this is how the patient would feel that you've heard. He just feel that he's being heard. In the end, the patient should feel that they're being listened to. That's it. Okay, so just nod your head, assure the patient that, yes, I hear you, Andrew. I understand that this is the problem, and I will do my level best to help you out. Every time you explain something, you make sure that the patient understands. Okay, this is how you will make sure that the patient is with you and he stays with you till the end, because it's very easy to use big terms and ignore the patient and just move on to the structure and talk in a rote manner. But instead, we're here to understand the patient, we're here to listen to the patient, we're here to reassure the patient that you're in safe hands and I will love to help you out. That's it. The minute you say these things, the patient becomes 100% more comfortable to talk to you. They're ready to listen to you, even if it's a difficult patient, just by saying that I hear you and I understand that you have this problem and I will do my level best to help you out. Trust me, even if the patient was angry, they will, become a little easy and they will, be a little easier for you to manage. That's it.
I agree in this. Guys, how we call this process? You know how we call it? You build up rapport. You build up rapport with the patient. This is the most important concept. You must learn it about OSCE. About part 1, about part 2. And if you work in clinic, you must build up rapport. You must build up trust. You must make the patient feel this is the best dentist ever. Whatever the dentist is going to tell me, I will follow up blindly because I trust them. They listen to me. They make me happy. They address my concern. They found solution for me. That's the best ever. And from here, once the patient feels happy from you, you will pass right away the cases. Either part 1, part 2. Now, Dr. Anne, ready?
Absolutely, doctor.
Okay, let's go ahead right now. Give me a second. So now back again. Okay, guys, we'll start now the replay. I will set up 10 minutes with Dr. Anne. Give me 1 second, please. Guys, what do you think, guys, Dr. Anne will do today? Do you think she will be great or not? If someone said anything about from she's not going to be great, if someone not going to say she's going to be great, I will be very upset, okay? I'm sure she will be perfect. She will be fantastic. You know what? I put pressure on her indirectly, by the way. Sorry. No, I'm just kidding, Dr. Okay. They may get 10 minutes reading.
Um, 3 minutes reading, doctor, and 10 minutes for presenting.
3 minutes, sorry, 3 minutes reading first, you want?
Yeah. Yeah,
Okay,
but I think I've read the case, but it's okay for me. I can start directly as well.
you can start directly, right? Okay, let's start now. Directly 10 minutes now, okay? Role play. Give me a second, please. Please, guys, write down the information Dr. Ann will say in this scenario. Timer. I will just only show the timing. Start, just only to show it. Okay, can you see now 10 minutes on the screen? Somewhere, maybe?
Let me see. Yes, I can see it. It's on the corner, yes. Can you
At the
restart
top?
it? Because yeah, because
As long as you can see,
yeah.
this is good then. Okay,
Yes, yes, now I can see it, yes. Beautiful.
give me 1 second,
Okay.
please. So I will start right now.
Just say 3, 2, 1 before you start.
Sorry, I say 3, 2, 1.
Just
Okay, 3, 2, 1. Okay, I will
yeah.
say 3, 2, 1. No problem.
Yeah.
Okay, that's fine then. Okay, let me just get this one here. You know the board part, right? Do you want to write down the board part again?
Yes, I know that I need to address your concerns and I need to talk to you about your condition and management and outline immediate and long-term management. That's it. And
Okay,
I'll be fine with it.
okay. Thank you very much for this, that's right. Okay, guys, everyone ready, guys? Pen and paper? Okay. Yes, please, Dr. Ann. I will count 3, 2, 1. Give me 1 second, please. Okay. Zoom again. Just ensure thing goes on time. Yep. 3, 2, 1. Start, please.
Hi, Andrew. Thank you so much for being patient while I did my examination. I understand that you're here because of your concerns with your upper denture, and there is some soreness of your mouth as well. Is that right?
Well, doctor, let me just to tell you the story. I have been feeling quite uncomfortable lately, doctor.
Mm-hmm.
The top of my mouth, which is a roof under this denture, is really sore and red. By the way, I have this denture since a long time. It's like my baby right now. So I don't want to lose it. It's a little bit,
Okay.
yes, loose. Doctor, it's a
Uh-huh.
little bit
Uh-huh.
loose.
Mm-hmm.
And broken here and there, and also old. But you know what? I really love
Mm-hmm.
it. I want to keep it with me. However, I may think about new denture as well, doctor. But
Mm-hmm.
the main thing is the roof of my mouth under the denture is actually sore and red. It does hurt
Mm-hmm.
me.
Mm-hmm.
Almost like I would say burning sometimes.
Mm-hmm.
And then if you took a photo for me, doctor, am I right?
Yeah, I did. I did. Yes.
Yeah, there's also crack in my corners of my lips,
Mm-hmm.
which never heal. I don't know why. It's there for
Mm-hmm.
more than now 2 weeks.
Mm-hmm.
They sting when I eat or even smile. I
Okay.
thought that was because I'm getting older. Do you think, doctor, I'm really old?
I don't think so. You look pretty young to me.
Okay,
82 is just a number. Don't worry about it.
okay. Thanks, doctor, for this reassurance.
Yes. All right. I've heard you, Andrew. Thank you so much for such a detailed explanation. And I assure you, you're in good hands. I will take care of you as much as possible. And I'll do my level best to help you in each way possible. All right?
Okay, doctor.
Okay. Let's talk about your concerns that you've mentioned to me. I understand that you treat this that you're taking care of your denture and this is what we want. So, but may I ask you a few questions to help you in a better way?
Yes, please, doctor.
Okay. So how long has it been for you with this denture? A
About
ballpark
10
area.
to 15 years.
15 years? Wow. That's like a teenager now. I think it's ready to go off to college, right?
That's a good one. Yes, doctor, you're right.
So that's okay. If you love this denture, we can definitely, keep it in a box, safe for you, but do not use it if it's actually falling. Or perhaps I would be able to help you with the, like readjustment or something. But let's see how it goes. Okay. So, firstly, you mentioned that you have sore mouth, and second, you mentioned that you have sore corner of the mouth as well. Okay. Let's talk about the corner of your mouth first. Is that okay?
Yes, please, doctor.
Okay. Do you know what this thing is called? The redness on the corner of your mouth. I have a picture here. See at the angle of your mouth, there's some redness over here. And like you mentioned, it stings and it hurts and it burns sometimes. Do you know why is this happening?
No, doctor, at all. I'm not sure.
Okay, I'll tell you that. Sometimes when we have folds of a skin at the corner of a mouth, this happens. Okay, this is called as angular cheilitis. Have you taken care of this thing by doing anything for it? Have you tried any medicine or anything?
Look, doctor, sometimes I actually wash it with my toothbrush and toothpaste because I feel there's
Uh-huh.
some inside. And most of the time as well, I put Vaseline on it.
Vaseline. Okay. So, I'll write down a cream for you. It's called Miconazole, and it's 2% that you have to use it. I'm gonna write it down for you so that it's easier. But instead of Vaseline, use this cream if this comes up again. Okay. And the reason why this might be coming up is mostly because of our denture. So, in order to cure this, we need to make sure that we have a healthy mouth. Okay. And why am I saying no to Vaseline? Is because Vaseline usually attracts bugs. So it's not a good idea to put Vaseline here. Okay?
Okay, doctor, that's good then. So,
Okay.
doctor, that's okay. Why this has happened?
Okay. Let's talk about that now. So you mentioned it's your baby and you've been wearing it for quite a while. Would you mind telling me how do you take care of your denture? Like, what is the protocol that you follow for hygiene, the hygiene of your denture and to maintain it in a certain way?
Yes, doctor, I do the best ever. I brush my
Mm-hmm,
denture on daily basis, once a day.
mm-hmm,
Then I brush it with the
mm-hmm,
same toothpaste I use to brush my teeth because I have a lot of them. And the toothpaste
mm-hmm,
is really, I got it from overseas. It has very nice polishing particles in it. And
mm-hmm.
also, I keep my denture in a white vinegar every night before I sleep, after I brush them, just to prevent any deposit to attach to the denture, doctor.
Beautiful, beautiful. And what else?
That mostly what I do, doctor.
Okay, beautiful. Okay, and how do you happen to wear your lower dentures as well? What's the situation of your lower jaw?
Sometimes I wear it, sometimes not, but not most of the time.
Not most of the time. And do you happen to sleep with these dentures also? Sometimes, maybe?
Not really, but instead
Mm-hmm,
I just put them in white vinegar every night or
mm-hmm.
water before I sleep.
Okay, that's good. Okay, and would you say that you've been stressed lately?
Yeah, just a little.
Okay, and what have you been doing for your stress? Oops, I think Dr. Adam, you dropped, but that's okay. How was I doing, guys? My patient was so stressed that he had to leave the meeting.
Yes, yes, doctor.
Yes, okay. All right. So, have you been stressed lately?
Yes, a little, yes.
So, what have you been doing for your stress? How have you been coping up with it?
I smoke and drink alcohol, doctor, every night.
Okay. And have you tried to seek any counseling, any help for it?
Not really. I feel like it's not required, not needed. I'm okay with the smoking
Oh,
and alcohol, doctor.
okay. So, whenever you're ready, just know that I'm here to help you out with the quitting only when you're ready. Okay. So
Okay,
I
doctor.
like to ask you how do you take care of your diet? Because like you mentioned that you wear your lower dentures only when it's required. So how do you eat? What sort of food do you eat?
Soft food mainly, doctor.
Soft food mainly?
Yes.
Okay. All right. So have you ever, like visited a dentist before and gotten your denture reassessed?
No, the last time was about 5 years ago.
5 years ago. All right. Okay. Now let's answer the question that you asked me, that why is this happening to you? There could be three main reasons behind it. This is why I asked you these questions. First, it could be an ill-fitting denture. That means this denture could be really old. Like you've already told me that yes, it is. It's been 15 years that you've been using this denture, and it's been about what you said, like 5 years that you've visited your dentist for this denture.
Yes, you're right.
So this could be one reason why your mouth is sore. Okay. Second could be the reason of improper hygiene. Okay. Like if you're wearing it at night or not maintaining a proper hygiene, this could be the reason. But like you mentioned that you've been an ideal patient and you've been taking care of your dentures and you've been, cleaning it very nicely. That's a good point. Maybe that's not the issue here. The third thing could be related to your immune system. Like I asked you if you've been stressed or do you smoke or take alcohol or any sort of medications. So you mentioned that yes, you've been drinking and you've been smoking as well and you're a little stressed as well. So this could be another reason behind it. Plus, with not wearing your lower dentures, there's also possibility that you're not getting proper nutrition from your diet. This is why there's some soreness around your mouth, which is called as denture stomatitis. So denture is something, like you have in your hand. Stoma means mouth and itis means inflammation. Okay. So in other words, you've basically got inflamed mouth. Do you want to know how we're going to help you with it?
Yes, please, doctor. How we manage this? How we manage denture stomatitis as well? You mentioned that I need a cream for the cracks on my cone of the lips. And then what we
Yes.
exactly need to do? By the way, doctor, is it really
Yeah.
good to brush my denture only once a day with the toothpaste? And then can I keep it in
Um,
white vinegar every night?
all right. So it's a good idea to brush your denture with your toothpaste and brush. But we usually prefer soapy water. I was about to give you the instructions for it. What I recommend my patients is that you need to have a sink full of water so that even if you're brushing with soap and water and your toothpaste, perhaps whatever, so you do not drop or slip the denture out of your hand and break it. Yeah. So it's going to be in the pool of water only. White vinegar is yes recommended one if we see heavy, deposits on our denture. Otherwise, no, it's not recommended. We need to keep our dentures in like a nice dry box in a dry environment so that the bugs are not getting attracted towards it.
Okay, doctor.
Okay.
Okay, so should I wear the denture all the night? Because you asked me this question. You said, do you wear the denture all the night, especially when I sleep? Should I?
No, 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 you should not because your mouth needs, to breathe as well. Like here, you have inflammation. So it's actually screaming that I want to keep this tension away from me because it needs to breathe as well. Okay. You need to let your mouth breathe by keeping the denture away for as long as you can. I understand there could be some social
Doctor,
commitments.
doctor, yes, doctor.
Yeah.
This is the point. I'm in a new relationship. You may think I'm 83
Mm-hmm.
year old and then I cannot be in a new relationship, but I'm in a new relationship and then every night
Mm-hmm.
with my partner, it would be very embarrassing when I remove the denture at night time. So what do you think, doctor?
Oh, that's so sweet that you're in a new relationship. I love love. So that's amazing. And that's okay if you are in a new relationship and you do not want your partner to know about it, that you wear dentures. I'll give you a very funny idea. You can give her eye mask, okay? She can put it on her eyes and she can sleep nicely while you can remove your dentures. Or you can bring her in for counseling as well. I can explain her that this is extremely normal thing to have.
And that's a good idea. Hopefully she will accept it. That
Yes,
is a good idea.
absolutely. Okay, let's talk about what we're going to do about your dentures today now.
Yes, please.
Sounds
By the
good?
way, doctor, can
Okay.
I get a new denture?
Yes,
What's your
I think it's a good
recommendation?
idea that you should. I think you should definitely. It's been 15 years and it's also falling down. So I would definitely recommend you to get a new one. But for the time being, because I understand that you're in a new relationship or you might have social commitments. This is why I will also temporarily realign this. Okay, so this will hold up a nice grip for your upper mouth, and it will be new as for the short time being. But at the same time, I suggest you to keep this denture out of your mouth for as long as possible. Second, um, get a new denture made for both upper and lower jaw so that there is no fold on the corner of your mouth and you do not develop the second condition that you have, that is called as angular cheilitis. Make sense?
Thank you, Doctor. Time's up. Okay, that was great, Dr. Ann. Guys, what do you think, guys? You did great, Dr. Ann. I really loved it. Guys, what do you think the good thing about this? What do you think, Ann?
I think I could not talk about the proper management, and I could not talk about the long-term management like follow-up. Apart from that, yes, I did, I think, try to help the patient as much as I could. And there's a small question here on the Facebook. Dr. Mohib is asking, isn't that too many questions? Dr. Mohib, if I wouldn't ask these many questions, I wouldn't know the exact cause. And if I don't know the exact cause, how would I be able to help my patient? So I need to, as a safe dentist, I need to address the cause first and then, work on other things. In order to address the cause, like here, my patient was a smoker and wasn't maintaining a proper oral like denture hygiene. I got to know only after asking questions.
Okay, guys,
Yes,
what did you
doctor.
feel about this role play? Did you feel it's more like a monologue or a dialogue? What do you think? Dr. Lakshmi is saying, imagine Dr. Ann. That is good then. She was calm. Yes, Dr. Ampish, I agree on this. Guys, you see the discussion between me and Dr. Ann was more like a dialogue, everything very natural. She's not under stress. I'm not under stress. We both of them very open to each other's. We talk nicely. She was very positive. Even while I was saying bad things about the clean part, I mentioned bad things, right? I mentioned that I brush her once a day only. I put the denture in white vinegar, which it shouldn't be every day. It should be kept dry, not in white vinegar every day, only maybe once a week if there is any deposits, and dilute vinegar. I mentioned as well that I brush the denture with abrasive type of toothpaste. I mentioned it has good polishing particles in it. It means abrasive to be polished. And then she wasn't against me at all. She was very nice. She said, yes, you do a really good job. I see this. And then she nicely moved from this point to give me the nice instructions. Right? And she was very smart. She has managed my situations. When I said I really need to wear it at night time, she gave me solutions. Right? And then when I was talking about smoking, alcohol, this stuff, she wasn't against me that much in it. And then she managed the denture stomatitis to take the denture out to enhance the hygiene. And then she managed angular cheilitis. She mentioned both of them. She diagnosed both condition. You know what? Let's look at the bold part. Let's see has she covered the bold part or not. Good. Look at this. Address the patient concern. Yes, she addressed every single concern I mentioned. Explain the conditions. Yes, she explained about and what is angular cheilitis, and she addressed some causes out of it, and then stomatitis, and management to the patient. She discussed about the hygiene part, outlined the immediate and long term. Immediate, she said she will do relining for the upper denture. And then you see her language was very nice. When I said, for example, this denture is 15-year-old, I like it. It's like my baby. She admits right away. And then she used the same word all the way from the beginning of the role play toward the end. She was saying, it's because it's like your baby, like your baby. Why? Because the patient will feel you are in the same line, in the same page. That's, guys, the communication skills. And then Dr. M mentioned, but Doctor, I couldn't talk about long-term management. I think she did. When she said about the denture, he needs a new denture. but it was short one, but at least it has been mentioned. So now, for me, that's the reason why Dr. Ann never failed any of her OSCE stations before. I hope, guys, this is really clear to every one of you. Again, do you think OSCE mainly is about to shower the patient with lots of information like, doctor, you know what? She didn't talk about staph. She didn't talk about yeast infection in details and all this stuff. She was open. Just it can be a part of infection happening, inflammation infection, the medicine should be taken. She didn't talk about bone resorption and how the denture were shrunk and all this stuff. But she mentioned just only simple words to explain the situation. I like this, to cover all these points.
Thank you, doctor. So, doctor, there's a question here. Dr. Gillen is asking me, is there a way to address a cause in a non-scientific way to the patient as he would not understand what is angular cheilitis?
Do you want to answer this question or you answer this question? What do you think?
Okay, I'll answer this question.
Yes,
So,
please.
Dr. Jiren, the thing is, if I explain, like I explained, there's a hole on your mouth and there's soreness there, the patient would never know what is happening with them. And with today's world, not even with today's world, everybody needs to know what exactly is the name, however hard it may be, however easy it may be to pronounce or for them to understand. They need to know what exactly I diagnose them with, okay? So that they know what exactly is happening. Would you not want to Google up irreversible pulpitis if I tell you that? You would Google up, right? We're living in this stage where everyone is, online checking it out. So if I tell him that yes, this is angular cheilitis and it is happening for so and so reason, okay? So they will immediately understand, oh, the holes that I have, the soreness that I have is called angular cheilitis. Okay. This is why we have to name. And by naming it, I'm actually checking my bold part. Can you please share the second slide, Dr. Adam?
It's here, doctor.
Just second point. Read the second point. A point it says explain the condition and management to the patient. So I explained and I named it because that's really important for diagnosis management. He would not understand what is my diagnosis, right?
Yes. You know what, guys, just to make it easy to you. Let's say, if someone goes to doctor for any reason, and then you say, doctor, you know what, to the GP, you went to GP, and then he said, doctor, I got headache all the time. I feel the headache is more like a belt around my head. And then sometimes I feel dizzy, doctor. If the doctor only mentioned this is called headache, you would say cold headache. What is this? And this happened because of this and this. What is this? But if they mention it specifically, that's called tension headache. This condition called tension headache. What will you do? Straight away, you get your phone and check what is tension headache. Why this tension headache is happening? How serious is tension headache? How you can avoid it in the future? What is the treatment of tension headache? Guys, am I right about this? So now, back again to your question. Should we really discuss the condition in its own term, the way we have in our books to the patient as angular cheilitis? The answer is yes. Should we say the word denture stomatitis? Yes. But explain it the way that Dr. Anna has explained. She said denture stomatitis. Denture it's mean the denture. Stomatitis mean stom. It means the mouth. And itis means inflammation. It means inflammation of the mouth mainly happen in the bearing area that's covered by the denture, which is the top of the mouth. Clear now, guys, about this question? I hope it does make sense to every one of you. That is great then. I love this question very much. Do we need to address folds because of reduced vertical dimension and need correction to prevent this future? Do we need to ask number of cigarettes? Okay. The first part is very valid. I love it. The top part about the loss of vertical dimension, it's really something very important to do. However, if you miss an exam, it doesn't mean you're gonna fail, because they collect marks for you, and mainly the marks for communication skills. But the second point, do we need to ask number of cigarettes patient smokes, and since how long? I would say this is vary from case to case, not every case. Now, denture stomatitis and angular cheilitis not directly related to smoking. Smoking, it can be reason behind it, but not the main reason. Now, should I ask about smoking? How many cigarettes smoke, and since how long? In this case, I would say if you have time, say it. But if you don't have time, just forget about it, because it's not the main thing. What about if the case were about cancer, about an ulcer that looks like clinically malignant ulcer, and then let's say on the lateral side of the tongue, and there for more than 2 weeks, like a month or so? Should I ask about smoking? Yes. Should I ask about since how long? Yes. Why? Because now there is a relevant information, direct cause. It can be the reason behind this cancer. I hope now it's clear to you. Side effects of smoking if you have time, but this type of cases, really lengthy cases. What do you think, Dr. Ann?
I agree with you, Dr. Adam, because this conversation is going to be too much because the patient has a lot of concerns here. Here, the patient is telling you that they have sore mouth and they have, like soreness on the corner of the mouth as well. So you would probably want to shift to that concern first and then maybe talk about other things like number of cigarettes and all. This doesn't hold much value here as much as, my patient's concern and my bowl part does. So I would rather stick to my bowl part than, hopping on to lengthy questions like side effects of smoking. This is important. Definitely, I will offer counseling. That's what I said to my patient that I'm here for you if you feel that you're ready to quit and want to talk about it. So I did address it, but very smartly, not using much time. And I move on to the actual problem that the patient was having.
Yes, you're right, Dr. Ann. By the way, guys, it's something very important has happened in this role play. Maybe you haven't noticed this. In the beginning, I was very talkative in the beginning. I think Dr. Ann, she just controlled this. Like, Ann, have you did this intentionally?
No, 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 no. I'm a good listener, you know that.
I don't know, but I felt like in the beginning you really, because I was talking a lot and see what you're gonna do, and then
Uh-huh.
somehow you just take the lead straight away. By the way, I have Dr. Nail here, and his name is very nice, Dr. Nail D. Lost Race. I hope I pronounce it nice. Dr. Nail say, if I'm going to sound like that during my part 2 exam, I am so sure that I will pass. Definitely, doctor. You will sound like this and they will pass. Okay, we answered Dr. Gilan's question. We answered Dr. Gotham's question.
Oh, I like to add to the part that where you mentioned that you were talkative and I didn't say anything. All I was saying is, uh-huh, yes, oh, really? Okay. So these are the points that, because Dr. Adam cannot see me right now, I was nodding my head along as well. But these are my small comments that would make sure that, that made Dr. Adam think that I was listening the whole time. Whenever he was saying that I have this, that, I was just like, uh-huh, yeah, yeah. And I also wrote down baby here because that's what he mentioned on my paper. And I also wrote his concern that he said loose. I wrote loose hyphen baby. And I also wrote question mark how long because he didn't tell me how long he has been wearing this denture for. So this is what you do while talking to the patient. And I
I
use the same word because, like he said, it's my baby. Sorry, Dr. Adam. He said it's my baby. That's what I said. That I agree that it's been 15 years. It's a teenager now, off to send to college. Like just breaking the ice so that the patient laughs. Maybe it's a poor joke. It could be. Okay. So maybe the patient laughs or he just becomes comfortable. That's it.
I agree with that, friend. Dr. Fatima says, Dr. Bedo seems to be an apprehensive patient. No, actually, I'm very nice today. You haven't seen me in the real role play in the
She
classes.
doesn't know.
No, you don't know me then in the classes. Okay.
Yeah.
Dr. Mohib says has to be in 3 minutes. No, doctor, the whole role play should be covered in 10 minutes, not 3 minutes. 3 minutes reading only. 10 minutes says Dr. Fatima, you're right. Okay, guys, how does it sound to you? Should we repeat this back again, this type of sessions for OSCE? Because part one we still don't, definitely part one of his sessions. Last week or the last 2 weeks, I have done the technical, and this week was OSCE. What do you think, guys? By the way, OSCE it's good because it helps both part one, part two candidates together. So, guys, if you feel this type of sessions helping you throughout your preparation, we're very happy to redo it again. If you feel they're not helpful for you, so we can stop them. Yes, can do more sessions. Okay, Dr. Sangeeta, thanks very much for that, for saying this. I really appreciate it. Yes, I love guys when you say yes, because that's making me more happier to help you more and more. What do you think, Dr. Ann? Thank you, Dr. Muhib, to say yes. Dr. Fatima, that is great then. Yes. Dr. Lakshmi, yes, definitely. That is great. You know what, guys, believe me, OSCE that much easy. All dentistry that much easy. Shouldn't be hard at all. Everyone
I
says
like
yes.
to
I'm very
say
happy to hear
something,
that.
doctor.
Yes, please, Dr. N.
So it's a very common knowledge that I've been your student throughout, and it's a very common knowledge that I've not joined any other tutors. So I'm gonna tell you straight thing from my heart that the day I joined you for my OSCEs, there was something that you said. Do not complicate things. Do not complicate it anyway. Just imagine your family is sitting there and what will you do? That's it. You need to baby down the things for them. Just make sure, I could have used a lot of heavy words here, but I did not. These are called jargons. I did not shower Dr. Adam with any information, anything. It was just a basic routine talk. And that's what Dr. Adam believes and has guided me throughout. So if you think that I'm good, it's just because he guided us this way. Okay. So you just need to understand that you're talking to your family and you're talking to a patient who is just 5 years of age. That's it. Okay. Irrespective. So you just need to relate to that. You need to baby that and do not use technical terms. Do not complicate it by putting in a lot of information into it or making it sound like a very complex case because it's really not. It's a conversation between you and your patient. That is it. Sorry, Dr. Adam, continue, please.
I agree in this. Guys, let's confirm this back again. You must not complicate the case. Use very simple language, easy routine language. I always tell all the champions, think the patient is 5-year-old or 10-year-old. And that's the best way to do role plays with your family members, your kids, the best people ever, to do role plays with your kids. If they can understand what you say, it means in exam you will be perfect. But if you do role plays only with your colleague, the one who is dentist, they understand every single word, he cannot stop you at the right point, the one which they couldn't understand because dentists understand everything, but patient acting like not dentist. So I agree in this, doctor. I see that everyone is happy with the session. Dr. Daniel say it is useful to hear scenarios. I agree with this, Dr. Daniel. Dr. Sura say more. Dr. Kriba say yes. Yes, please, very helpful. Dr. Maylin, I'm very happy to hear this, guys. Yes, Dr. Bido, Dr. Aftab saying this. Dr. Daniel, isn't it this a bit too much to ask of you? No, I was okay. I mean, I am super thankful for that, but is it okay to ask all of that? Yes, I believe so, Dr. Daniel. Thanks very much for you being very caring. Thank you very much, Dr. Daniel. Can we practice the OSCE in Australia with you, Dr. Bido, the Academy? Yes, Dr. Muhib, definitely. With this time, we somehow have an idea of what we'll encounter in our part 2 exam. Yes, Dr. Neil, encounter. Yes, you're right about this. Dr. Fatima, Dr. And during the conversation with the patient, you had mentioned about which ointment to use. Is it necessary to mention at the start of the conversation? I love this question. Perfect question. Wow. Or toward the end, while explain the treatment. What do you think, Dr. Ed? This is, guys, by the way, this one of the smartest question we go today. Yes, please, Dr. Ed. What do you think?
So I've already replied to her, Dr. Fatima. I just wanted to know what Dr. Adam is doing currently to take care of his own concerns. Because, let's say you have a toothache. I will ask you, have you tried any medicaments? Have you tried something to relieve you of your pain? Because that's a very normal thing to do. This is why I asked him right up front. So if he is using, let's say, miconazole itself, I would say, yeah, that's a great one. How do you know about it? You know? So he could tell me that, maybe somebody guided him or something. But he was using Vaseline. So this is why I just wanted to correct him that, okay, Vaseline is not a good idea because it attracts more bugs. This will address those concerns that he did not even have. Okay. So it's actually giving him knowledge and addressing his concerns as well. So the patient is happy. Oh, okay, now I know that I'm not supposed to use Vaseline in this area. Okay. In the beginning itself, when I did, it could be any time, any time that Oskies. I just used it in the beginning because it was part of my conversation because I was talking about angular cheilitis that time. You can use it in the end as well that have you tried something for this or not? But it just felt natural to me. That's why I started in the beginning as well. And feel comfortable whenever. If you feel comfortable towards the end, do that.
Okay, can I add something here, Dr. Ann, as well?
Yes, doctor.
Okay, Dr. Fatima, this question is very smart question. Why smart question? Because many of the candidates think they should only cover the treatment toward the end. It's wrong. Treatment management at any time can be given as long as you can support your diagnosis. Look at this photo here right now. When I look at the photo from the information, the cracks on the corner of the mouth, is it really looks like angular cheilitis or not? Yes, clinically it's angular cheilitis. Is that because the denture is loose and all this stuff? Yes. Because loss of vertical dimension? Yes. All of this, and patient has denture stomatitis. All of this stuff, it gives me a trust and belief. This is an angular cheilitis. Now, what's the treatment for angular cheilitis? It is miconazole, antifungal. Can I just say it at the end? Why? The patient right now has asked you about this condition, and the patient at the beginning has told you that he's using Vaseline at that time. Now, I don't want to forget. I want to make it natural. I want to go in flu. Just natural, easy. Say it now, because if you don't say it now, you may forget it toward the end and doesn't look natural. So that's the best way to say it the time that the patient has a concern about it, or it goes smoothly with the flow of the role play itself. Doesn't matter at the end, at the beginning, but I prefer at that time to be at the beginning because it was nicely going naturally with the flow of the scenario. Otherwise, you may forget it. Thank you for this perfect question, Dr. Fatima. Now, sir, please, this kind of role play of topics that cover ADC part 1. I will do this, doctor. When TG task 2 mock will be released? I believe I made a poll, and then I'm waiting for the last answer for the poll. It should be either on Thursday, Thursday, Friday, or Saturday. Okay, guys, I believe we did good for this session. I believe we have had most of you in this session and answered most of your questions. Most probably, we will do more sessions of this to learn more about part 2 and to pass part 2. And I see you one of our champions. Guys, how many champions has passed this year? From part 2, I think about 100 so far. Being every 2-3 weeks, we have about 7 to 10 people. 5, 7, 10 people. I think we really got about closer to 100 right now. I believe so. Which is definitely never happened before. So one day you can be one of them. Thank you very much, guys. All the best to you then. See you then next session. Our part 1 champion, see you tomorrow. Our part 2 champion, see you on Thursday and Sunday. Thank you very much, you guys. Have a great night. Thank you very much, Dr. N.
Thank
That
you,
was
guys.
really
Thank you,
good.
Dr. Adam, for having me here.
Thank you very much, you guys.
Bye-bye. Good night, guys. Good night, everyone.
Good night. There's still a question from Dr. Nail here. Yes, Dr. Nail, you're right. And doctor, is it better that we only answer that what the patient is asking? Because patient might go, I love this one. And give so much of, I love this one. Yes, patient consent. Easy. Make it easy and simple. Now you got the point. No problem, Dr. Shiva, at all. Thank you, Dr. Shiva. Yes, tomorrow will be the private, Dr. Gilan. Tomorrow will be the discussion of the private mock, the one that's already been uploaded on your Google Drive. Tomorrow will be the discussion of the second TG task, private mock, the one's been uploaded in your Google Drive. No problem, Dr. Fatima, at all. It's my pleasure. No problem. Thank you, Dr. Sarel. Thank you very much, Dr. Sarel. No problem, Dr. Nail. Thank you very much, guys. See you then soon. Thank you, guys. Bye-bye.